Hi, Angela. I'm Dr. Harrison's nurse, Stephanie. I understand that he's recently diagnosed you with hypertension and he's prescribed you Enalapril or Vasotec. Do you have any questions about this drug?
Yeah, I do. I don't know that much about hypertension or this drug. Can you tell me more about both?
Okay. You were diagnosed with hypertension due to your consistently high blood pressure, and we put that in a certain criteria, and that's what diagnoses you with that. It makes your heart work harder because your vessels are smaller than they should be, so this drug is going to help make them bigger and decrease that workload on your heart and on the rest of your body, because if left untreated, hypertension can cause some serious effects.
Okay.
It's due to both genetic and lifestyle factors. I saw on your chart that you have a family history of hypertension. That can definitely contribute to why you have hypertension. Another thing to take a note is lifestyle changes or lifestyle factors that have led to this. I saw that you smoke cigarettes. That can contribute to that, as well as having a more sedentary lifestyle. I saw that you're a secretary, so you spend most of the day sitting, not getting a lot of activity. Also, eating a lot of fast food can contribute to that.
Okay, so what do I need to do to lower my blood pressure?
Okay, well, a great start would be to stop smoking cigarettes. Another thing would be to try to lower your weight. So what we want to do is we could try different diets, such as the DASH diet. So I'll give you information about that as well as portion control. The DASH diet lowers your blood pressure by decreasing salt intake and fat intake, which in turn lowers your blood pressure.
Okay.
Another thing we need to focus on is exercise. So we can start off very slow, about 30 minutes a day, just most days of the week. It doesn't have to be every day, just what you can tolerate. So just some walking, and then over time, if you want to increase that to like brisk walking or jogging, then that would be great.
Okay.
This drug itself, Enalapril, will also help decrease your blood pressure. But it's important to know that this drug will help treat it, but it does not cure high blood pressure.
Okay. So you can tell me more about this drug, like how often do I have to take it? Do I have to take it every day, twice a day?
Okay, you'll be starting off at a low dose, which is 2.5 milligrams a day.
Okay.
By mouth. You are going to be trying to take it the same time every day, and that's gonna be the most effective.
Okay.
So if you forget to take it, take that dose as soon as you remember. But if it's close to the next dose, don't double dose. So be careful when you're changing positions, like if you're laying down and you're getting up, you want to do that slowly to prevent any lightheadedness and dizziness from the position change. Also, the first time you take it, it's advisable to lay down due to the sudden drop in blood pressure.
Okay. Okay, so I just have to take it once a day, every day, and just kind of be careful when I'm moving around. So what are the other side effects of the drug?
Okay, a dry, persistent cough occurs in some people, and usually it's manageable, but if it becomes unmanageable and you just don't want to deal with it, call your doctor, and we'll try to get you on a different kind of treatment.
Okay.
Also, it can increase potassium levels in the blood, so if you're taking any potassium supplements, don't take them, because having a really high potassium level can affect your body in adverse ways, and we don't want that.
Okay.
Also, if you plan on getting pregnant, let the doctor know, or if you do become pregnant, let him know, because it can cause some serious problems and complications in pregnancy. Also, be very cautious when you're using over-the-counter medications, this Tylenol and ibuprofen, because they can decrease the effectiveness of this drug.
Okay. Okay, so I understand. So this drug is going to help me lower my blood pressure, and if I do some lifestyle changes, that's going to help too. And then when I'm using this drug, kind of watch out for changing positions, because I can cause lightheadedness. Call the doctor if I want to get pregnant while trying to keep my blood pressure under control. Call a doctor if I have any major swelling, and call him if I have an allergic reaction. Is that all?
I think that you have a really good understanding of this drug, so great. I'm going to be providing you with some handouts to take home with you, because I know it was a lot of information all at once. It's kind of overwhelming. So you can bring that home with you, read it on your own time. Also, don't hesitate to call the doctor, or you can talk to a pharmacist if you have any further questions about this drug.
Okay.